On Thursday, actor Saif Ali Khan underwent surgery to remove a knife in his spine and neck after being attacked by an intruder in his home early that morning. Doctors told the media about the surgery, adding that Khan had been moved to the intensive care unit. A doctor explained to reporters that the procedure was necessary to take out the knife lodged into the body and address a spinal fluid leak caused by the injury. Since the news broke out, everyone has been wondering what is this spinal fluid that leaked. Let's understand this. The spinal cord is covered by a cerebrospinal fluid CSF to protect the spinal cord. Now this fluid is covered by a plastic layer called a durometer. When there is an injury such as stabbing in Khan's case, it may result in a dural tear where the dura, which is otherwise a tough protective membrane, is ruptured. This tear can lead to a cerebrospinal fluid or CSF leak. This leak is dangerous because there is a risk of infection spreading to both the spinal cord and brain. It can cause a condition known as meningitis, which can be life-threatening. Besides meningitis, CSF leak can also result in other diseases which can lead to headaches, seizures, and in some cases paralysis. In the case of a minor leak, treatment may only require medications for 8 to 10 days. However, in case of major CSF leak, it is necessary to seal the tear via surgery. Now the procedure is called duraplasty or dural closure, and it is recommended treatment for a CSF leak. You will be surprised how this fluid protects the brain and spinal cord. The fluid acts as a soft pillow which protects the brain and spinal cord from bumps and injuries. It also provides floating support to the brain by reducing the brain's weight so that it does not press on the skull. Not just support, it also provides a nutrition supply to the brain and removes waste along with protecting from infection. It keeps the brain and spinal cord clean and helps prevent infections. Its leakage can lead to extremely crippling symptoms as it can give intense headaches that often get worse when standing. A person will feel extreme dizziness, nausea, neck stiffness, and sensitivity to light. The fluid also helps in controlling pressure inside the head and creates a balance for the brain to work properly. In simple terms, CSF keeps the brain and spinal cord safe, healthy, and balanced. While in Saif Ali Khan's case, the extent of the injury is unknown, doctors told News 18 that recovery depends on the extent of surgical intervention, where physical activity is limited for 2 to 4 weeks to avoid re-injury or re-leak. In the long term, normal activities are gradually resumed over several weeks and most patients recover completely with the right treatment.
Recently, one of the famous actor of the country is in the news because he sustained the spinal cord stab injury. Here is some information that you should know. Spinal cord injury is basically the severity is depend upon the angle of the weapon which injured the spinal cord, whether it is injuring the direct spinal cord or surrounding structure which is covered the spinal cord like dura, and there is a cerebrospinal fluid leak after that. So if we transit the spinal cord at the upper level, cervical spinal cord, there will be a paralysis of both the limbs and lower limbs, as well as your urinary control and bowel control will be lost. In thoracic spinal cord injury, if there is a transection of the spinal cord directly, there will be a lower limb paralysis only below hip. In case of lower lumbar spinal cord injury, there will be a foot weakness. Now, if there is a spinal cord injury that is an acute emergency, patient has to supposed to bring immediately to the nearby hospital, should be operated. That stabbed weapon supposed to be evacuated in the surgery, it should be explored well, followed by the outer protective layer dura should be repaired, so there should be no CSF leak after that, because it may lead to a grievous infection called meningitis of the brain and spinal cord that's supposed to be taken care. This is the acute emergency, so it has to be very crucially patient supposed to be there for 1 or 2 weeks, the ICU, and then followed by ward. This is the basic information you should know.